Hi everybody, in this video I want to just draw your attention to a few very powerful, effective, evidence-based ways to fight this pandemic as it is and improve our total anti-epidemic status altogether. So these ways, when I'm talking about it, I ask you to please watch this video, and if you disagree, just tell me what I'm wrong, in what I'm mistaken, and also, please, if you agree, please share this video, because I've been trying to draw attention to this topic, and some of the methods I'm going to be talking about, they're so cheap, easy to implement, obvious, that I was hoping that we're going to get, some of those methods implemented right away, or at least we're going to get some, research done and evidence showing that this is not effective, it doesn't work. But unfortunately, I just see the people are being ignorant. Any healthcare worker I talked about this method says that this is the first time he hears about those things, so everybody gets surprised, and I don't want to be a big surprise. I want to actually people to talk about it more, and we actually have to implement those things because they're so good. And if you're like me, you probably were thinking, so it's 21st century, isn't there anything else we can do to fight this pandemic aside wear masks and sit home? Or actually there is a few methods that I'm going to be talking about, and those methods are as follow. Vertical laminar airflow ventilation system. We can easily modify each ventilation system to work as that. There's a way to do targeted COVID testing and any other infectious disease testing, and targeted quarantine instead of quarantining everybody just all together. And we can also keep all the surfaces around, high-touch surfaces, sanitized constantly, very cheaply, with the UV light. I'm going to talk about it, how it's supposed to be used. The last thing, we can much improve our PPE so they would be comfortable, and people would have much better protection when they wear them, especially healthcare workers, because they're very precious in this situation. So let's start with the first thing, airflow. So I encourage you to go around the places where you work, where you live, where you go, like supermarkets. Just pay attention on how the ventilation systems are set up. Pretty much any place has a HVAC system built in. You can see the grids on the ceiling that push air in and suck air out, so they keep the system conditioned. And I want you to go and pay attention how dirty those things are. They're in terrible conditions. Even good hospitals, I'm talking more about hospitals in terrible conditions, so we cannot expect to fight any whatsoever disease with that. And the further thing is, so we have to change our environment, because that's how COVID became so aggressive. It's a common cold virus, but it mutated to be very aggressive. And if we don't change our environment, we're just gonna end up having other, new strands, new viruses, new epidemics, and just go in circles. And actually, that's what CDC talks about, because they have many chapters, and it has been researched years ago how to influence different epidemics. There used to be a pyramid showing how different things can impact the epidemics, and there's things like PPE, quarantine, and other stuff. So it turns out PPE, let's say, they do just a little thing to help epidemic. They don't alter it a lot, but there's thing called engineering solution that actually changes the picture. It's a big thing. It makes us fight epidemics much more effectively. So that's what I'm talking about, engineering solutions. And so having all these HVAC systems, and some hospitals, they put HEPA filters in the rooms, and those are not really effective, and I'm gonna explain you why. So because both the conventional HVAC systems and HEPA filters, what they do, they introduce through the one grid, usually it's one, maybe two at most at the room, they introduce a high velocity airflow that's being forced into the room, and it actually instantly mixes with all the air around. Then it sucks the air somewhere up top usually, and so it keeps that air traveling throughout the room. Sometimes it has to travel from the room to the hallway, or vice versa. So it travels horizontally, moving the particles with it, and then it keeps them suspended in the air because of that flow. And if you think that small grid that sucks the air in, for example in HEPA filter, it's a small place, there's no airflow directed towards it precisely, so that just the air that's around it, the particles that accidentally come around it, actually get sucked in and filtered off the room. All the other particles, they're being instantly mixed with the pure air that's being forced out of the air purifier, and it gets contaminated right away. So those systems are ineffective, but because of how they move air from one place to another, they can actually move particles. And if one person stays upstream to the flow and the other person stays downstream to the floor, and that upstream person is infected, so it's gonna take the infectious particles from that person and move them to one who is a healthy person. That way those systems can not only be ineffective in fighting this disease, they can provoke and they can actually facilitate the spread of diseases. So what we can do is implement what's called vertical laminar flow ventilation. Those systems have been for decades used and researched in so-called clean rooms, such as where they manufacture high precision things like computer microprocessors, where you cannot allow a single dust particle in the air. That's where they use them, and they're being used in some operation rooms. So if you have a big open wound, you don't want any bacteria get to that. So that's how they use it, to make the air virtually close to sterile in those rooms. So right now we cannot gather in closed rooms indoors, because that's where you get the spread of the disease. But what if we modify our system to a system that actively and effectively eliminates the particles and actually drags them out from us instantly? Then we can achieve a high level of security in virtually any crowded place. We can not only make it not a good place for infectious disease to thrive, we can make them actively fight against these infectious diseases. So what's the principle behind that laminar flow vertical ventilation? The principle is simple. You want the air, the clean air, to come up out of the ceiling, and from as much points in the ceiling as you can get. Virtually the best way is to get all the ceiling. Push in clean air independently, and then it gets sucked down by the floor, somewhere by the floor. So the particles, they're not getting mixed because it's a laminar flow. So you virtually push the whole layer of air coming down from the ceiling, clean air coming down from the ceiling. Everybody who's in the room gets it independently, not mixed with other people. He gets the clean air that's then being dragged down, takes all the particles with it, including the particles you just produced, and drags them down, and then it gets pushed directly into those suction, the outlets that suck the air out, and it gets then it can be recirculated. So we can easily modify any HVAC system to work that way. For that we need just few steps. First step is to place HEPA filters on the outlets, the one that suck air out of the room, so we can keep the whole system clean. And to prolong HEPA filter life, you can put a dust filter and foam filters, because foam filters are usable and dust filters are very cheap. So they will take the majority of the dust that's in the air, majority of gross particles, and prevent HEPA filters from clogging up. That way we can dramatically increase lifespan of that HEPA filter and decrease the cost needed to maintain the system. The other thing you have to do, you wanna get that grids that push the air into the room. It's going to be now clean, sanitized air. You want to distribute that flow so it doesn't come out from one grid, a high velocity flow. You want to put just a few simple, cheap ventilation hoses and distribute it, let's say, into the four points into the room as much as you can. And then you wanna tilt those hoses so they would be directed towards the ceiling. So that high velocity flow that's being thrown out from those hoses, it's not going to be instantly mixed with ambient air. It's going to first hit the ceiling and then get evenly distributed and lose its velocity. So we are pretty much achieving laminar flow at this stage. And the last step what we can do to even more and further improve the system. So we want to put a second layer of sealing, but instead of putting some plates there, we want to put gross foam there. So the foamy filters that you can sometimes see people put on their ACs or any other, what it does, it creates a slight impedance to the flow. So that slight impedance, if you put it throughout the whole ceiling, you make it foam. So that foam, it throws off that high velocity. Instead, it makes the pressure to even above that foamy ceiling, to even in all the spots. So after, beneath that foamy ceiling, you're gonna have a same amount of positive pressure pretty much in any given space of the ceiling. That's how you how easily it's to get a legit laminar flow. So you're gonna have a layer of air going from the ceiling down. And the last thing you want to do, so you want to take that outlet that sucks the air out of the room, you want to drop a ventilation hose or maybe a few hoses there, so they would go down maybe somewhere in the corner of the room where they don't interfere with your daily activities. So they would go down close to the floor, effectively sucking particles that get pushed down the floor. So even if it goes to one corner of the room, that's not a big deal, because up here where your head is, where the respiratory system intake is, you're gonna have clean air in the upper part of the room, pretty much sterile air. If you do any interference, if you mix anything, it's gonna be constantly just keep on sedimenting and keeping the upper part of the room extremely clean, actively fighting against infection. Okay, this is one thing what we can do. It's really cheap, it's effective, we have research on it. The other thing what we can do, we can use focused UV light. So I've seen some hospitals implementing UV light. They put it somewhere on top in like random place in the room, and that's not effective, because if you withdraw just a few feet from that lamp, and as you know, it refers to pretty much any type of radiation, any type of light, it gets distributed really quickly. It gets disseminated. So if you withdraw just a few feet from that lamp, the amount of radiation you get is just it's insignificant. It's just negligible. So it doesn't provide any effective sanitization just a few feet from the lamp. So if you have a lamp located somewhere out there, it's just not effective. But what you can do, and what you do with the flashlight, if you have a small bulb that emits just a little of light, but you need to lit up a certain object, you put a lens on it. So you can put a plastic lens on UV lamps to focus UV rays, because glass lamps are gonna absorb a lot of UV. Plastic is not gonna absorb UV, but it's gonna focus it. It's gonna focus it on the object that you wanna keep it focused on. So all the radiation from that lamp is gonna go to that one object that you focus. That way you can constantly keep some things, like you can focus it on the doorknobs, on the elevator buttons and things like that. So people are not getting exposed to UVC radiation, but those high-touch surfaces, they're kept constantly sanitized. Virtually, you cannot sanitize them all the time. You cannot keep things like doorknobs or things such as elevator knobs. You cannot keep them constantly sanitized with just wiping them down. And it's like you have to use a lot of personnel for that. You have to use a lot of money for that, for the disinfectants itself. So that's not efficient, it's not effective, and it's not cost efficient. But if you put a lamp, it has a long half-life, it has a long lasting life, so you can keep it for a long time, and it's going to constantly keep those surfaces constantly sanitized at all times. The third thing, the targeted quarantine. So in our modern 21st century, it's easy to make app to share any type of information, but people have been restraining from apps that track your infectious contacts, because usually they require a lot of personal data, and they might take things such as your geo data. They can track your position, your location, which people don't want because it's a privacy violation. But my friend helped me actually have a prototype of app that is very simple, and it doesn't gather any of your personal information, doesn't gather your location data. It can work either by scanning QR codes, either by Bluetooth. So if you and the other person have this app on your phone, Bluetooth activated, it assigns you anonymous number, and it assigns the other person, everybody gets their anonymous number, which they don't even have to know. It's kept in a secure database. But what it does, whenever you come close to somebody and your Bluetooth interacts with that person's Bluetooth, with that person's device, it just makes a mark that on this day you two were close to each other. It doesn't mark the time or your location, just that you have seen each other. So it keeps you private. But then if anybody gets sick, you or that person, each one has an ability to send anonymous message, anonymous standardized, it's not a messenger, it's an anonymous standardized message saying that we've seen each other in, per se, past 7 or 14 days, and I've been diagnosed with some kind of infectious disease. Please go get tested or see your physician. Go quarantine, stay quarantined. So instead of just losing billions of dollars by keeping everybody quarantine at all time, we can make this process targeted and let people stay informed if they have been in contact with somebody infectious, but keep it anonymous at the same time. And we have made people to go into crowded places wearing masks, which everybody is against, but still people have to obey this. And we can do the same thing with those apps. We might, everybody can just, all the places, the hospitals, the supermarkets, they can just require people, in restaurants, they can just require people have those apps and have them turn on when they are visiting this place. This is as simple as that. And we can immediately cut on if we do this directed quarantine, we can immediately quarantine most of the infected people. That can by itself pretty much just stop the spread instantly. And as easy as it sounds, and that's for free. Making app is easy, it's free, it's zero investment, and it's gonna help us with all the other infectious diseases. Okay, and the last thing is PPE. So as the way the PPE is right now, usually people, they wear some kind of mask with the open filter, and they might wear it for the whole day, and they might frequently change things like gowns, which all of that costs. But those things are really uncomfortable, and so people don't pay much attention, or they don't wear them appropriately. For example, they will not keep their respirator tight simply because it can give you pressure marks, or it can be painful. And the gowns, they make you sweaty. It's uncomfortable, so people take them off really quick without appropriate disinfection. So some research have shown that it is the time when they take off their PPE where you can get infected. And that makes a lot of sense, because if you wear your respirator and some stuff gets on it throughout the day, you contact with the patient, and then you take it off, you pretty much dust it off. A lot of particles can go in air, and then you can inhale them. The same thing goes for your gowns. Yeah, you got it on when you were in the room, but then you go out and you toss the dust off it. It gets distributed in the air, so you reduce the efficiency of your precautions that you just did by simply how they are constructed. But there's easy way around it. You can make, and we have what's called popper. So those are powered air purifying respirators. So they have turbine that blows air, forces air into, let's say, a hood, a helmet on the person's face. Instead of just having that, we can make the popper blow into the airtight suit that you can reuse, and you can wipe it down with chemicals, disinfect it as you go. Instead of just tossing it, you can just keep it clean throughout all day. You can wipe it down in a few seconds and go to the next patient, and you can wipe it down before you doff it so you don't get infected. But so that popper or PAPS, powered air purifying suit, it keeps you comfortable. You don't sweat inside because you have a lot of fresh purified air coming inside that keeps you comfortable inside. So people would want to wear this type of PPE, and they would want to do it. They will have no problem doing it appropriately because it's comfortable to do it appropriately. So on my page you can find videos on how I made a prototype of one such suit of cheap house available, like just generally available materials, because it is really cheap. It is generally available and you can make it. And I want you to share this video so PPE manufacturers can pay attention to that and make those suits, make them available so healthcare providers can get them and they can stay safe, and they wouldn't be afraid. They wouldn't have all this emotional toll, and they wouldn't feel panic. They wouldn't feel afraid to work with their patients because they're gonna feel safe, because they have a good PPE that they can use and they are not afraid to get infected. So those are the 4 things I wanted to share with you. Again, please, if I'm being wrong in something, please tell me what I'm wrong about. If you actually find this idea, these things that I've talked about are reasonable, please share this video because nobody pays attention to those things. I strongly ask you, everyone, to share this video. At this point, I wanna wish you a great day, and I hope for some response for this video. And have a great day, everybody. Bye-bye.